Okay, what's your name?
My name's Kristy.
Kristy, what's your favorite ice cream?
My favorite ice cream, one of them is pistachio nut. It's yummy.
Any specific brand?
I like the Rite Aid one.
Can you tell me, what are you diagnosed with? What is it called?
I'm diagnosed with leiomyosarcoma.
What is that? Can you
So
explain?
it's kind of like a rare form of cancer. Mine is originated in the small intestines. So there are some that are originated elsewhere in different parts of the body. But the main thing is to treat it, they usually need to surgically remove like the whole section of the cancerous tumor with what they call wide margins, which means healthy tissue around the area they cut off too.
Okay.
So that doesn't spread. So that's the ideal treatment because chemotherapy and radiation are not shown to work very well.
I see. So it's in the intestine area then.
Mm-hmm. Intestine area, and mine is on the intestines and the whole lower abdomen.
So did you decide what medical options you're going to take?
So, well, one of my prayer requests was to not go jumping around searching everywhere for how to treat this cancer. So I wasn't going to go get like one doctor and then another doctor for another opinion, another doctor to find all my options. My prayer request was for God to give the doctors wisdom into or what treatment options they wanted and felt comfortable offering me with. And from there, I would pray about it and make my decision. So, talking to the doctors at my hospital, they said that they didn't have anything that could really help me, but that Stanford had more treatment options as well as the background to potentially help with my treatment. So they sent me there, and from there they decided first course of care was 2 types of chemotherapy, drugs at the same time through IV infusion. But from there, that medicine only has a 40% chance of working to reduce my cancer. And so they're thinking at originally 6 months of chemo and then surgery, but now they're talking about 2 months of chemo and surgery again.
Oh, so do they know where the cancer is?
The thing is, it doesn't show up on any of the scans because they're what's called little implants. So that little spots of cancerous cells that have not grown up large enough to be noticeable.
I see. I see. So 2 months of chemo and then maybe surgery afterwards?
Again, yep.
Oh, okay.
And so they'll have me talk to the doctor then after 2 months.
What about like radiation?
Radiation, it's always an option, but since it's not shown to work very well, there's other options of doing radiation, more pinpoint radiation during surgery, and whatever other else, but right now they haven't talked about it.
I see. So do you know what kind of side effects the chemo have?
Lots of fun stuff, like severe nausea and fatigue are the 2 main key ones, and then there are side effects such as swelling, like excess fluid in the body, or bleeding in the gums. Those are the main ones. There's all sorts of other ones that can go with it, like diarrhea, lack of appetite, muscle weakness, things like that.
So with chemo, how do they target, how does it target, the cancer cells?
Well, cancer cells divide quicker. And so the chemotherapy drugs target not specifically the cancer cells, but they target all cells that divide.
Okay.
And so that's why the immune system drops too. So because it targets the white blood cells and the cells in the body that reproduce really quick.
Okay, I see. So how do you keep such a positive outlook?
My positive outlook definitely comes from my faith in God, because God's proven himself to me over and over again when I've been in tough situations. From having to deal with being physically molested to tough choices with my family, going on vacation, and my dad parks on the beach, and the water starts to come up, and having to deal with. There's been a lot of things in my life that have been out of my personal control, and so I've really seen God come through in those times, and because of that, I've been able to trust God this time around as well.
Okay, great. So you're always so busy. What's the best way that your friends and family, what can they best get a hold of you or support you?
Best to get a hold of me would probably be through email, especially since at work I don't really have access to my phone. So, but feel free to call and leave me a message, and I'll call you back when I can. But best and easiest is email. And to meet up, the thing is, like, being busy, that is true, but at the same time, I'm still learning that busyness in my life is not a good thing, in the way that, like, being part of the youth ministry and church and doing all sorts of activities is a good thing, but at the same time, I want to be able to treasure my friends and family more. And so, unfortunately, it's been a juggling thing where I'm trying to be like, okay, when do you want to meet up? Oh, sorry, this date's taken. Oh no, you're busy? Okay, how about this date? And until finally just find a day to meet up. But I really appreciate the patience I've seen in a lot of our friends who are like, you guys are so busy, we have to make an appointment with you. And that makes me feel really bad, but at the same time, unfortunately right now with so much scheduled in, it tends to be like that, even though it's not a preference. But maybe someday in the future when, like, Noel and I aren't so busy with maybe youth ministry, or we learn how to juggle our schedules a little bit better, that it won't have to be like that.
So, how are you financially to, fight this long battle coming up?
That is iffy, because right now, well, the good thing about my work is it's county job, and it's really stable. My bosses, supervisors, and managers are really willing to work with me and modify the schedule as needed. And they've been able to tell me, yeah, whatever I need, if I need time off, then take it off. If I can work, then I work. So that's been a huge blessing. At the same time, just found out this past Friday that Noel's going to lose his job too. So, or not too, but Noel will lose his job. And so that will make things interesting, because recently we've been dealing with our budget and trying to figure out, can we live off of one person's budget? And right now with the mortgage and my school loans, it's not going to work. But at the same time, I remember back in college, whenever there were times I ran out of money or thought I ran out, God would always provide.
So, could we start a fund or something to help you out?
This question, it makes me really nervous, because for so long I'm just used to being independent, oh, I can take care of myself, I can do things. But I'm learning that I do need to trust on others, and funds may potentially be part of it.
That's great. So maybe we'll look it up and see what's possible out there for all your friends and supporters.
Thank you.
So you talk a lot about your identity with either paintball or rock climbing and counseling.
Mm-hmm.
So you're still gonna try to do all those things.
I want to, because part of it is just having played paintball yesterday, it was so fun to just be out there. So it's not just the activity alone, it's time spent with a whole big group of friends that I really appreciate being with. Shooting people getting shot up is just a really fun part of it. So it's not something I will willingly give up unless I feel so tired that I'm okay, I just need to rest, or I can't do this. So it kind of depends. I'll just have to go along with it as I see. And for youth group, I've already talked with the youth pastor and the other student leaders and counselors about the potential of the fact that I may be there or may not be there. I'll always be reachable by phone, and I'm willing to help out and advise for sure, but I may not be necessarily physically present.
I know you have lots of friends and families and supporters. Is there anything like, you know, you want to tell them or share with them?
I want to say that thank you for everyone's support. It's been really touching, and it means more to me than I can say. And that I wouldn't be here and I wouldn't have my positive attitude if it wasn't for everyone's support. And I hate crying. My friends and my family are my anchor. I know that God will always be there to provide, but part of God's huge provision is my friends, and they are my family. And that's where I get most of my support and comfort from, is everybody around me. So I know I don't go through this alone, and I know that I will never have to struggle by myself. And so that's where my confidence comes from.
Well, thank you for doing this, and I'm sure everybody, you know, loves seeing you and talking to you, and you're the most positive person that I know. And I know you're gonna go through, you know, some tough times, but you know, everybody's here to support you. Any way you want.
Thank you, Stephen. Thanks, John. And then big thanks to my hubby, because he's had to deal with all of this. And Noel's had to field a lot of people's concerns and offers to help.